Thank you very much. First of all, good morning, everyone. Delighted that you could join us. Conscious of time, I think this session is going to get away from us pretty quickly. So let me just start with the problem statement that Dan and I are going to try and address in the next 20-25 minutes. And that, I think, is two-pronged. One, that healthcare, the cost of healthcare benefits is just increasing at an unprecedented level. I'm going to touch on that. And secondly, that employees increasingly want personalised solutions, communications around their benefits to identify the fact that they have unique and diverse needs, and they want those needs met through benefits. So those are the two sort of problem areas that Dan and I are going to try and address in the next 20 minutes. So I can now get on to this. I'm delighted after the keynote speech that Tim did that I've only got one slide of stats for you to pull apart. And I'll try and get through this very quickly. But the point I want to make here is I think we need to reframe this issue around healthcare costs, because I think healthcare costs are a societal issue that are impacting on benefits. And what do I mean by that? If we look at the cost of healthcare delivery globally in 2023, $7.9 trillion US. That's projected to be $10 trillion US by 2027. And by 2040, according to the Deloitte's report that's cited up there on the board, that's going to be 25% of global GDP. That is unsustainable. We have a societal issue with healthcare costs that are impacting on benefits. Why is that? And I think there's a number of issues, but three main issues that I'll call out. First of all, I think public healthcare systems across the globe, where there are public healthcare systems, are overstretched. We're seeing that in the UK. Referral to treatment times are approaching nearly 8 million people on those waiting lists. We're seeing this in markets that in the past didn't have the need or the desire for private healthcare, places like Germany, where supplementary healthcare is now being desired by employees, and employers are starting to meet those demands as well. I think we've seen a change in claims patterns in the last few years for a variety of reasons we don't have time to go into now. And also prevalence of NCDs, non-communicable diseases. So be that cardiac, be that dementia, those NCDs, the prevalence of those continue to unfortunately tick up, which is impacting on healthcare costs. I think we should pause and say, well, look, why haven't employers done more to try and mitigate some of these healthcare costs? And again, I think there's a variety of reasons. I think historically, we've relied on the public sector to deal with chronic conditions. If you think of private healthcare plans, they typically pick up the acute stage of chronic conditions. So I think chronic disease management is something that I think we're going to see more in benefit plans going forward. The other one, I think there's an investment time lag on healthcare benefits between action and impact. And as we get challenged over return on investment, having that time lag is not helpful from a healthcare perspective. And finally, I think there's an opportunity cost. Our total reward budgets are increasingly stretched. We've had the cost of living crisis, people wanting increases, quite rightly, from a base pay perspective to keep their standard of living up. We have other competing factors, such as needing to fund adequate retirements. All of this means we don't have the amount of money we would like to spend on healthcare risk management. But Dan and I are here to convince you over the next 20 minutes that AI is going to help. And genuinely, I do think it is going to help. I think we're going to see efficiency in the healthcare system and the healthcare delivery, but also in that personalisation and engagement bit. And very quickly, a couple of stats around AI. I'd be remiss if I didn't do that. It's not the how quickly ChatGPT got to 100 million users. We've probably all seen that. But first of all, AI as it is today has probably only about 1% or less than 1% of the connections of the human brain. Yet, it's got an IQ, a verbal IQ of 155 and increasing, which will put it in the top 0.1% of humans in terms of natural language understanding. It also has general knowledge 1,000x more than any human. and learns at about 300 times the pace of human. I put learns in quotes. But despite that, or maybe because of that, if you listen to mainstream media, AI is going to do one of two things. It's either going to kill us all and then replace our jobs. Yeah. Now, if we're very lucky, it might do it the other way around. We're just not sure yet. Yeah. But anyway, look, let's get back to the point at hand. Dan, I know you're an investor and involved with a portfolio of companies that are leveraging AI. Be good if you could sort of share with the audience how you've seen employees leaning into that, the benefits they're getting, and let's try and give people some real-world examples.
To start with the bigger picture, I've been investing in startups for the last 10 years or so, and the tide of shift towards AI driven businesses has changed dramatically over the last couple of years. And now I think 90% of the businesses I see have AI as a core component of what they're offering across all sectors, including benefits and healthcare. And it's for one of two reasons. Either AI dramatically improves the efficiency of what you already do, or AI allows you to do something that was impossible to do before. And it's worth thinking about those two things separately. And I think companies that don't do the former will die, and companies that do the latter will generate enormous wealth and success that is otherwise missed out on. And then going to the specifics, most benefit solutions have some kind of user service interaction, which historically was brokered by people. And turning that into something which is either done directly by a bot or done by a bot which helps the agent to serve the people better is a dramatic improvement in typically accuracy and speed and satisfaction of the user. A McKinsey study was released recently that looked at, not just in benefits, but in general chatbot usage, and the cost of a typical chatbot interaction with a chat interaction with a human was about £2.50 per chat. It goes down to about 15 pence with a bot. But more importantly, the typical resolution time goes from about 40 minutes with a human on average to less than a minute with a bot. And while people are obsessed about whether the bot can give as good an answer, the quality of the answer is actually the quality of the experience, not just the actual words that come out. So if you can give an equivalently good answer in 30 seconds versus 30 minutes, your customer, the employee, is massively happier. And that is the real impact that you get from using this kind of technology effectively. And if you think about the dynamic of a chat interaction, if I chat with an agent and the agent is dealing with 4 or 5 parallel chats, which is usually the case, then I have to wait. And while I wait, I open up another tab and I look at my email. And then the agent comes back and I'm not there looking, so then there's a gap. And so that multiple delays means it takes 30 minutes. Whereas if the answer is instant, then I'm engaged, I answer instantly, I'm resolved in 30 seconds, I think that was bloody good. And that completely changes the interaction. And I think that's the starting point for organisations, is think where your interactions with your employees are painful but could be made as good, much quicker, much cheaper, everyone's happy.
So Dan, I'd be remiss if I didn't dig into that issue around quality of response, because I'm going to anticipate one of the Slido questions is going to be around hallucinations, bias. So, yeah, give us a response to that.
So that there are different ways that you can manage these AI assistants to control for that kind of hallucination. And I think it's the job of people like you to filter the offerings to present the ones that actually work in a robust way. So I'm an advisor to a business called Anya, as an example. It's a women's health advice service. And rather than using ChatGPT as the source of the intelligence, they have curated a clinically proven set of answers and then built their own chatbot on top of that to manage the interaction. And so that chatbot does two things. Firstly, it makes sure the answers only come from this clinically proven bank of answers, which are all medically recommended. And it manages the emotional state of the dialogue, so that you can detect from the time of day and the previous interactions and the type of question asked whether the user is in a state of kind of functional managing my to-do list for tomorrow versus it's 3 a.m. in the morning and I can't get a latch from my breastfeeding and it's a nightmare and I'm feeling distressed. And you need to give the same information but with a very different tone based on that. And you can train the chatbots to do that. And so it's a combination of making sure that the content is correct and the tone of delivery is correct is something that can be delivered by these bots if they're well designed.
So it's validated clinical data set as opposed to generic LLM, and then it's fascinating that ability to actually show empathy in the answer, which again you've pointed out through an Anya perspective, and I guess that empathy also links through to people getting a personalised response, and I know you've got some other companies that are involved there, and that point around engagement that I made, I think if you get that personalisation bit, as you say, I haven't got another tab open, actually I'm now engaged.
Exactly, yeah. And a lot of the sort of very basic and the version 1 bots were just a skin on top of ChatGPT, and so they had the hallucination issue, but they also didn't have any knowledge of you as a user and any continuity of the dialogue. Whereas a well-designed bot in a corporate setting, with your permission, will remember from your previous conversations. So again, if I go into Anya, I don't have to tell it that I'm a mother of a 2-year-old and I'm pregnant, because that's been learned from a previous dialogue, and so my answers will be given in that context, which is important. So that kind of personalisation is key. And then I think an even kind of a better example is a business called Runner, RUNNA, which is an AI coach for getting people to run. And there are plenty of coaches out there that can help you to complete your Ironman. But if you're trying to get off the couch and do your first 2K, then that might be something where people would be reluctant to have that kind of coaching assistance. It seems like inappropriate. But this solution, an AI-driven, context-aware coach that will help encourage and coach and deliver the right kind of exercises and give the right kind of encouragement feedback after you do stuff to keep you motivated, can help you get off the sofa and do your first 1K, or it can help you to go to your Ironman from your half Ironman. And it's all very personalised based on information that you give it at the beginning and reading the signals from the exercise you actually do from your smartwatch or your Fitbit or whatever. And so that kind of personalisation can really help people achieve their fitness goals. And you see that people who set a fitness goal with one of these kind of AI coaches have a massively higher continuation rate and continue with their fitness. It's not just a kind of January the 1st to January the 12th kind of fitness plan that we've all been, probably many people have hands up and had one of those before. These things stick.
So what about the other end of that, people that get engaged for that personalisation piece? Are you seeing any examples where there's any stigma or seeing a positive aspect where actually AI is helping people overcome stigma of engaging with chatbots?
Yeah. One of the things we found at Salary Finance was that a lot of people who are in financial difficulty are embarrassed about the fact that they've let themselves get there and don't want to engage with another human around that issue with the fear that they will be judgmental. Whereas they are much more happy to speak with a bot, an agent, and talk about their issues, knowing that they will get quality information and advice without the risk of judgment. And so I think that's an example of how, for some people, a non-human interaction is not a cheaper but worse alternative, it's actually better. And similarly, there's a reasonably recently launched business called Mettle, METTLE, which is focused on men's mental health. In fact, it's focused on men's mental fitness. They've deliberately positioned it not as a solution to a problem, because a problem is something that might have a stigma and that you might want to talk about. It's positioned as you're a bloke, you go to the gym to make your body stronger, why not come to Mettle to make your mind stronger? That's not a negative, that's not a stigma thing, that's a positive association with a better future. And that's, again, something that's much easier to deliver through an electronic screen, an interface they're always engaged with, than it is necessarily booking time to go and talk to a consultant or a therapist or a coach, which for some people have a negative connotation. So I think there's lots of opportunity there to bring more people into the fold of getting help if you can deliver the right kind of empathetic, tailored, personalised electronic support.
Yeah, no, I can see that. In terms, final one that Dan, around, I mentioned right at the start, long-term condition management, chronic disease management, I think is going to be an increasing part of employee benefits to mitigate worsening health risk within our organisations. I know you've got an interesting screen coming up in the next couple of weeks. Do you want to just mention that company, because I think that's quite interesting as well.
Well, just background, you said at the beginning that our health service is stretched and it's mostly chronic condition management. I think we call it a health service, but it's really an illness service. It only services people who are ill, not people who are healthy. And that's not to say anything wrong about it. It's a brilliant service, but it's a service for people who are ill. I think it's important as employers that we also think about delivering services to people who are not yet ill to avoid them getting ill. And whether that's mental health or whether that's female health conditions or whether that's many other things. And I've signed up for a scan with Neko Health. Anyone heard of that?
It's Daniel Eck, isn't it? From
Daniel
Spotify.
Eck is the Spotify founder. They've just opened up their first clinic outside Stockholm, where it was launched in London. There's a waiting list as long as your arm, but I managed to get on it.
I'm still on the waiting list.
I managed to get on it ages ago. And what they'll do is for £300, they'll do a full body scan and a cardiovascular scan and a blood scan. And then at the end of the hour, you speak directly in real time to a doctor. And they've used AI in the background to analyse every single mole in your body and all of the signals from the cardiovascular trace and so on, and give you some advice on how to manage a healthy lifestyle going forward. But the real value of it, and probably their genius from a business model point of view, is it's not a one-off, it's a longitudinal thing. And they book you in for a year later and a year later.
The first one's a benchmark, yeah?
The first one's a benchmark. And so next time you say, well, that mole wasn't there last time, so that's one we need to worry about. Or your cholesterol has changed significantly since last time, what's changed in your stress levels or your lifestyle or whatever. And so it's that longitudinal information into a health system that can help you take preventative actions before things get bad, which I think is going to be an increasing part of what the best employers will offer their staff, and an increasing way of avoiding the cost of chronic disease and illness management later on, because you catch stuff early.
Yeah, it's that move to preventative from reactive, which we all know about that trend.
Yeah.
But I think it's what's happening in the digital healthcare space.
And so much of that preventive stuff is just not economically viable if it's just based upon humans. If you've got a dermatologist that has to physically look at the pictures of every single mole and map them a year later to the same pictures, that's just not going to work. But if you can put it into a scan and 5 seconds later for no cost you've got a map of what's changed, that's very different. There's another business that I was looking at which engages people in a agent-driven conversation with a chatbot that sounds like a human, but it declares what it is. And through that conversation, it will ask you various questions which are quite sort of mentally challenging. And on the back of that, they can do a very, very good early screen of likelihood to move into a state of Alzheimer's or other cognitive impairment issues. And they've benchmarked that against the best professionals. They've got a similar accuracy, and it's incredibly cheap, and you can do it on a repeat basis and see how things are progressing. And we all know that if you intervene early with Alzheimer's, then you can massively improve the outcomes. I guess most people in the room here have got parents who are either going into that worry stage or have already gone there. I certainly have. And so I wish that these tools had been available a little while ago.
Yeah, I think that scalability is a key point. I'm conscious of time now. We've spoken around and focused on that sort of employee experience bit with AI, and I think I just want to come back around to those sort of general healthcare statements and issues around inflation and medical inflation. I mean, we've seen WTW have just carried out a survey, Global Medical Trend Survey, showing that I spoke about public system before, this is now private system, that next year again we're looking at global private healthcare inflation at over 10.5%. In the UK, projected to be 12.6%. But my first point, and that point that you touched on around scalability of technology, and I think we're now into that space. And my first statement or takeaway there is, over time, AI, I think, is going to be deflationary to healthcare delivery. There's a book, I don't know if you've read that, Jeff Booth, The Price of Tomorrow, an interesting book that delves into that point that over time in all industries we see technology being deflationary, and I see no reason why that won't happen in the healthcare space. And there's multiple examples of where that's going to happen. I think AI is going to enhance the productivity of healthcare professionals. I mean, you touched on some of that from the dermatology, radiology, reading scans. We can see that clinical output being enhanced by at least 10x through the enhancement of AI. I think we're seeing some fascinating advancements in the personalisation of medicine, aspects like digital twins, a virtual you, where medicine is now going to be personalised and will be a lot more impactful. The accelerated drug testing and therapy that we're seeing, Alphabet's DeepMind have been doing that for a while. Out of Hong Kong, in silico, have been using zero-shot learning, and in 21 days came up with 30,000 new drugs. Three of them are Class A drugs. Yeah, I mean that's incredible. That is game changing. That will increase the speed of new drugs coming to market, but will also dramatically reduce the cost. So back to my point, AI is going to be deflationary over time. Second point there is hybrid healthcare, a concept I've been using for a while now, and I think that this is the combination in my mind of the quantified self for digital therapeutics, things like wearables. It's that combination of monitoring healthcare and then healthcare delivery in clinic. I think we're going to see a shift of where and how healthcare happens, monitoring things digitally and then treatment actually happening in clinic. I think that is going to have a deflationary impact on healthcare over time. We then got healthcare 2.0. So point that you made, this move to predictive from reactive healthcare. I've no doubt that's going to happen, and AI is going to span that whole value chain in terms of healthcare delivery. And then a couple of impacts to be aware of from an HR and benefits perspective. This change is just happening so fast, yeah? That exponential pace of change. Things that used to happen in years and decades are now happening in weeks and months. And I think that's a challenge for all of us to get across just the speed and the pace of change with AI from a healthcare and benefits perspective. And then the final point is something I've been talking about for a while, is the need to focus on the transformational, not the trendy. I'm sure you've all got emails, people picking up the phones, wanting to speak to you about the latest and greatest thing in the benefits space from a healthcare perspective, yeah? And that's great. You get attracted and employees get attracted. I'm sure they bring it to your attention, the latest shiny thing. But I think one thing we need to do is focus on the North Star around this, which is around ensuring that these benefits, one, engage with our population, but also that they positively impact health risk management, because ultimately that's what this is about, having benefits, having a suite of benefits and solutions that actually have a positive impact over time from a healthcare delivery perspective. Well, you did say we weren't going to have any time for questions. I can see the 10-second clock at the back, so I think with that we will wrap, and I'll pass back to you, Janet.